Buong bansa'y tumutok na dahil oras na para sa napapanong balita tungkol sa gamot teknolohiya sa bansa. Ito ang DOST Report. Magandang araw Pilipinas, ako po si Oring Miranda, ang inyong kapatid sa Imbabawid. Ngayon po March 26, 2021. Talaga pong napakabilis ng panahon, huling Biyernes na po ng Marso. At ang Department of Science and Technology po ay patuloy pa rin sa paghatid sa inyo ng magandang balita mula sa mundo ng gamot teknolohiya sa bansa. Dahil Secretary Boy, handang-handa na. Magandang araw po, Secretary.
Magandang araw naman, Onin, at magandang araw sa ating mga taga-subaybay.
Alamin na po natin, sir, ang latest updates tungkol sa science and technology programs sa bansa, sa sektor ng kalusugan, kabuhayan, kaayusan at kinabukasan. Mga kaibigan, narito po Secretary Boy.
Okay, Onin, katulad ng dati ay una kong ibabalita yung mga may kinalaman sa kalusugan at kabuhayan. At pagkatapos, yun namang may kinalaman sa kaayusan at kinabukasan. So I will make my report this time in English about kalusugan. The first one is actually an update coming from the DOST, Philippine Council for Health Research and Development, or PCHRD, regarding the result of their profile study, the study that they supported, and this was actually done by the Philippine College of Physicians, and it was the conduct of a retrospective multi-center observational cohort study of 2,884 RT-PCR confirmed and admitted COVID-19 patients in 89 hospitals in the Philippines. This is from February to July of 2020. This study showed that the majority of COVID-19 patients were, as expected, Filipinos, 99.4%, with slightly more males at 54.4% than females. In conclusion, the study has comprehensively confirmed factors associated with the disease and its mortality, and was found to be consistent with results from studies done in other countries. Factors associated with an increased mortality include, of course, I already mentioned, age, which is greater than 60 years old, presence of tachypnea, hypertension as comorbidity, and WBC, white blood count greater than 10 times 109 per liter, and an elevated serum LDH. So it is recommended that future epidemiologic studies on COVID-19 patients should come up with a system to standardize data collection, units of measure, and reporting among all participating hospitals. The second item under kalusugan is the report coming from the Food and Nutrition Research Institute, or FNRI. Our DOST FNRI project, SAGIP. SAGIP stands for Project on Supporting Adolescent Growth in the Philippines. Supporting adolescent growth in the Philippines. So in line with the implementation of this project, the last 2 days of consumer type sensory evaluation plus incentive distribution among adolescent students of Upper Bicutan Elementary School and High School have been continued. All 6 meals provided to the participants receive ratings between 4 and 5 on a scale of 1 to 5, where 5 is the highest. Majority responded that they can eat all the food provided to them with regards to serving size, and positive feedbacks were recorded, and that the participants found the meals tasty and nutritious in general. And as the recipe testing nears its end, all results, are currently being collected and rechecked. All developed recipes are also being updated and will be forwarded by batch to Chef Geraldine Cabello Maglalang, the culinary expert consultant of the project. The next item, still under kalusugan, is actually an update on the distribution of the repurposed RX box for the management of COVID-19 cases. So the latest deliveries were to UPPGH and to the Batangas City Isolation Unit. So our DOST, Calabarzon, which is in charge of this, coordinated the delivery by Ionics EMS, which is producing the RX box, of 50 RX box units with replaced new tablet batteries to UPPGH Cibol Group for the deployment to COVID-19 wards at the PGH, Philippine General Hospital, on March 23, 2021. And in addition, DOST Calabarzon turned over a unit of RX box to the Batangas City Health Office for deployment at the Batangas City Isolation Unit on March 18, 2021. On kabuhayan, I would like to report that our DOST, Philippine Council for Agriculture, Aquatic, and Natural Resources, R&D or PICARD, and in partnership with Palawan State University, implemented Pangtawid program for coastal communities through which were affected by Luzon lockdown, through the seaweed farming, which is a project implemented by the Palawan State University. It aimed to disperse pre-selected fast-growing seaweed cultivars from the culture facilities of the Palawan State University Marine Science Laboratory to Seaweed Farmers Association. So from laboratory to our farmers na ito. A total of 3 hectares of sea-based seaweed nurseries using pre-selected fast-growing cultivars in the municipalities of Nara, Dumaranan, and Batarasa, Palawan were established with 1 hectare of nursery each for each project site. So the seaweed growth performance for strain collection was determined in the sea-based nurseries established in the 3 project sites. And then a training on the initiation of community-based seaweed enterprise was conducted, wherein 100 seaweed farmers served as participants. Seaweed farming or seaweed farm materials were distributed among the members of Tagisan Seaweed Farmers Association in Nara, Paho Fisherfolk Association in Sarong, Batarasa, and Kabugawan Fisherfolk Association in Dumaran, Palawan. And here is something interesting from the Metals Industry Research and Development Center. Rubber boots, okay, made to look better through the services of DOST MIRDC. Actually, this is for the company named Boscolo Manufacturing Corporation, which is in the business of making rubber boots. It is the company behind the Spartan brand. Mass production of these boots are possible to the rubber injection molding technology. So the company sought the help of our DOST MIRDC in the middle of last year, and the intervention that was provided to them is the rehabilitation of the 24-piece aluminum boots mold, which were imported and already 5 years old. Through the technologies and facilities available at the DOST Metals Industry Research and Development Center, the built-up portion of the molds were polished so that the resulting boots will retain their clean and smooth surface. Also, with the available mold technologies, our Metals Industry Research and Development Center developed a CNC program that designed the contoured surface of the molds to give the boots its signature Spartan armor, mold, Viking, and helmet logo. So the DOST MIRDC welcomes the opportunity to serve our metalworking related needs of businesses across various industries. Diyan muna aking kinatapos na unang bahagi na may kinalaman sa kalusugan at kabuhayan onin.
Maraming salamat po, Sec Boy, para sa unang bahagi ng inyong report. Mga kaibigan, narito pong muli si Secretary Boy para sa pagpapatuloy ng DOST report, Secretary.
Salamat, Onin. Ang isusunod ko namang ibahagi ngayon ay yung tungkol sa kaayusan. At ang una dito ay ang pagla-launch ng DOST PBOLC sa kanilang Spectral Acceleration Maps of the Philippines. So the DOST Philippine Institute of Volcanology and Seismology officially launched the Spectral Acceleration Maps of the Philippines. They call it SAMPH, SAMPH. It is an atlas and the launch was made via Zoom last March 23, 2021. Part of the event was the turnover ceremony of the SAMPH Atlas to the Department of Public Works and Highways. So I turned it over to Secretary Mark Villar and to the Association of Structural Engineers of the Philippines, led by Engineer Sison, or this is the ASEP. The atlas contains very detailed maps of the National Capital Region, Cordillera Administrative Region, Regions 1, 2, 3, 4A, 4B, 5, 6, 7, 8, 9, 10, 11, 12, Caraga, and Bangsamoro Autonomous Region in Muslim Mindanao, or BARM. The SAMPH Atlas can serve as a reference for engineers, building designers, and urban planners in the design of essential and critical structures and facilities such as hospitals, dams, power plants, roads, bridges, and railway systems to withstand intensity 8 earthquakes. Okay, so it can also be used for the assessment and retrofitting of existing structures to conform to building standards. The SAMPH Atlas is apt and timely to support the national government's Build program. This atlas, together with the previously rolled out earthquake model atlases of the Philippines, of Metro Manila, Metro Davao, and Metro Cebu, can be utilized for infrastructure audit and retrofitting of existing structures to conform to the current building standards. It can also be useful for urban development, risk assessment, and site-specific insurance rates. Now, the next item in Ayusan is something that is a very welcome news. Our DOST Advanced Science and Technology Institute, or ASTI, received an award from the Naval Research and Technology Center. The DOST Advanced Science and Technology Institute, through its wireless technology team under the Solutions and Services Engineering Division, received an award as a technology partner of the Naval Research and Technology Development Center on the occasion of its 6th anniversary. DOST ASTI collaborated with this center and RTDC in the development of their low-cost 24/7 signal jammer detection system. Detecting signal jammers is important in building a secure and dependable wireless network. The award is the NRTDC's way of showing gratitude to its technology partners who have supported and contributed to the center's research and development projects. We also have a report coming from our Industrial Technology Development Institute, or DOST ITDI. They held what they call the MatDev Forum. The MatDev Forum. MatDev stands for Material Development. So DOST ITDI held the MatDev Forum, gathering industry, academe, government, and non-profit organizations in a stakeholders forum which was held yesterday, March 25, 2021 via Zoom. The forum aims to present MatDev's current and future activities that highlight the role of additive manufacturing in increasing our country's readiness for the future. It was broadcasted live on Facebook with about 144 participants, including media. The highlight of the event was the virtual tour of the MatDev facility, showcasing an array of 3D printers, spheroidizer for metal powder synthesis, 3D filament extruder, cryogenic and planetary ball mill, high temperature furnace and characterization equipment like 3D scanner, digital microscope, and dynamic mechanical analyzer. Our MatDev program, okay, or the development of multiple materials platform for additive manufacturing is part of DOST's Advanced Additive Manufacturing R&D program, or AMSEN, that is jointly implemented with the DOST Metals Industry Research and Development Center. So if ITDI is focusing on materials development, MIRDC naman is focusing on the advanced prototyping. Okay, the MatDev laboratory was actually inaugurated on December 22, 2020, and on April 12, we will inaugurate the AMSEN building at the Metals Industry Research and Development Center. So we move to the last item on kaayusan, which is regarding the calibration services that are now available for accurate temperature readings for COVID-19 vaccines storage in Region 10. So pwede rin itong part of kalusugan. Ano? So DOST provides calibration services to ensure accurate temperature readings for COVID-19 vaccines storage in Region 10. So this is in support of the nation's COVID-19 vaccination program, and it was implemented by our DOST Region 10 Regional Standards and Testing Laboratory. It is required that the temperature of 2 to 8 degrees Celsius is maintained in the particular brand of vaccine while the vaccines are stored. Otherwise, these vaccines become ineffective. Hence, the importance of maintaining well-calibrated storage facilities. So as of March 20, 2021, the DOST Region 10 Regional Science and Technology Laboratory already calibrated 9 biorefrigerators, 3 refrigerators, 1 freezer, and 13 wall and dial thermometers from various health facilities in northern Mindanao. The details are as follows. These are coming from the health office, hospital item equipment, calibrated number of units from from the PHO Misamis Oriental, Capital Compound, Cagayan de Oro City, biorefrigerators, freezers from Misamis Oriental, Provincial Hospital, Initao, Misamis Oriental, biorefrigerators from rural health units in Misamis Oriental, and of course municipal health offices like the ones in Manolo, Fortis, Bukidnon, and from the Misamis Oriental Provincial Hospitals in Initao, Misamis Oriental in Region 10. So that is for kaayusan. So I move now to the last part, the last K, which is kinabukasan. The first item here is a report from our DOST Philippine Council for Industry, Energy, Research, and Emerging Technology Research Development. So the DOST shared.
Okay.
So this is a project that we are supporting at the De La Salle University, and they developed a fire and heat resistant geopolymer-based cement. Okay, engineers from the De La Salle University developed fire resistant cement made from local waste materials such as volcanic ash, red clay, and baluco shell to contribute towards a circular economy in producing eco-friendly, highly efficient materials for safer homes and establishments in the Philippines. A source from the Bicol region, the research team focused on understanding and uncovering the potential of novel green materials from indigenous materials or agro-industrial byproducts while providing a potentially sustainable solution for waste management. Using these waste materials, the team developed geopolymer-based cement that has lower carbon footprint compared to the ordinary Portland cement. The next one is a good report from our Philippine Science High School, still under kinabukasan. 50% of PSI students have become honor students in Q1 amidst the pandemic. Despite the challenges of the shift from face-to-face to remote learning, 50% of the total student population of Philippine Science High School made it to the director's list. The honor roll of students whose grade general weighted average is 1.5 or better, with the highest grade of 1. This is for the first quarter of school year 2020-2021. Academic records show that it is significantly higher compared to that of school year 2019 to 2020, with 33% students in the director's list. So from 33% to 50% in the honor roll. Meanwhile, 82% of PSI students are of good academic standing, with the general weighted average between 1 to 2.25 in the first quarter of the current school year. This is lower by 15% as compared to last school year, which is at 97%. The Philippine Science High School system is implementing its leverage mechanism to help the 18% of its student population with grades of 4 or 5, or those who have difficulties in adjusting to remote learning to improve their grades. So yung natitirang 18%, most of these are parang incomplete grades. So we need to give them more time. Okay. So and then we move on to, of course, one item from the region. DOST Region 2 launched the first Philippine Smarter City Belt project. Okay, they did this last March 24. Under the leadership of Director Sancho Maborang of DOST Region 2, they introduced the first Smarter City Belt project in the Philippines. This is expected to highlight synergies and collaborations between and among clustered cities and municipalities that leads to smart outcomes. Smarter City Belt is a collaborative project that aims to make cities in the region future ready. This can be done by using the latest technologies and innovations from DOST, the R&D outputs of the state colleges and universities, and those from the higher education institutes. In Region 2, the Smarter City Belt project is composed of Kawayan City in Isabela, the first smarter city in the region, together with 3 other chartered cities, namely Tuguegarao City in Cagayan, Santiago City, and Ilagan City in Isabela. There are also emerging growth centers which wish to become smarter towns, and these are Bayumbong and Solano in Nueva Vizcaya, Mandela, Camarokis, and Dipun in Quirino, and Lalo and Santa Ana in Cagayan, as well as Basco in Batanes. The project will address challenges in the region through the use of science, technology, and innovation to enhance opportunities relating to sustainable development. So, yung mga technologies na na-develop, okay, to implement, for example, ICT-assisted delivery of health services, smart solutions to transportation and traffic problems, smart solutions also for education to deliver learning to students, and other smart technologies, whether it is agriculture or waste management, or even, of course, in the governance itself. Okay. Now, we also have a report from the Philippine Council for Industry, Energy, and Emerging Technologies, R&D, or PSERD. This is about the DOST putting up the first Philippine e-mobility R&D center. Okay, we start muna with a simple vehicle. Recognizing the economic and environmental benefits of electric vehicles, or EVs, the Department of Science and Technology is supporting the establishment of the first e-trike R&D center. Okay, this will be located at the Cagayan State University, and the center is set to specialize on the local manufacturing of e-trikes, with the Cagayan State University to take on its design, development of different parts, and assembly, while the University of the Philippines, Diliman, will focus on the design, fabrication, and testing electrical and electronic systems for the e-trikes. UP Diliman will also capacitate Cagayan State University to establish their own power electronics laboratory to fully sustain the system needs of the e-trike R&D Center and help develop electric vehicles specialization in Cagayan State University's College of Engineering. The CSU team is planning on making low-cost, rigidly strong e-trikes that can withstand varied loadings and road conditions, as the design and parts will be extensively tested for stability and energy efficiency. With the hopes of transforming the Philippines' local transport sector, the Cagayan State University team is also studying the viability of converting conventional tricycles into e-trikes in partnership with a company called Legider International E-Trike Electronics Assembly Philippines. And last but not least, I would like to report, okay, that the Department of Science and Technology, the Department of Trade and Industry, and the Department of Information and Communications Technology signed a joint administrative order, okay, last March 22, 2021, to assist startups under the Innovative Startup Act. So this joint administrative order on the implementation of Republic Act 11337 or the Innovative Startup Act of 2019 and the management of the Philippine Startup Development Program was virtually signed. And this aims to support Philippine startups and empower entrepreneurs for a stronger and more resilient economy. We did the signing virtually. I, representing the Department of Science and Technology, Secretary Mon Lopez, representing the Department of Trade and Industry, and Secretary Gregorio Manasan II for the Department of Information and Communications Technology. And this joint administrative order now organizes formally the steering committee for the programs under the Innovative Startup Act. Each of the departments actually has their own startup assistance development program, but of course we try to at our best to harmonize our own separate programs through the steering committee. It shall be composed of 3 permanent members with the 3 agencies designating an undersecretary or assistant secretary to fulfill the role, and then with 2 regular members from each agency that shall be designated by each permanent member for a total of 9 representatives. So the steering committee shall lead the development, implementation, and updating of the Philippine Startup Development Program. On the part of the Philippines, we really we're waiting for this creation of the steering committee because this is needed before we can implement our own grants in aid assistance program, particularly for research and development for our startup enterprises using new technologies and innovations. And hopefully, we can already give the first grant under our program before the end of this month. So this is all about the DOST report for March 26 on in. I hope our viewers have learned new things out of this report. Thank you.
Maraming salamat po, Sec Boy, at mga kaibigan, yan po ang latest update tungkol po sa science and technology programs sa sektor ng kalusugan, kabuhayan, kaayusan at kinabukasan. At sa amin pong pagbabalik, pag-uusapan natin ang pag-aaral at pagkakadiskubre ng mga maaari natin mapagkukunan ng gamot mula sa halaman at iba pang microorganismo sa ilalim po ng programang Tuklas-Tunas ng Department of Science and Technology. Kabilang po yung pag-aaral sa tawa-tawa at lagundi bilang potensyal na panlaban sa COVID-19. Atin din pong pag-usapan ay sa pag-aaral tungkol sa mga factors na nakakapekto o may kinalaman sa mortality ng ilang COVID-19 patients sa mga ospital. Kaya wag po kayo alis, mga kaibigan, magbabalik pa ang DOST report. Kayo po yung nakatutok sa DOST report. Alam niyo bang umabot ng 10 to 15 years ang pag-develop po ng isang gamot? Pero dahil po ang Pilipinas ay isang mega-diverse na bansa, may 1,500 species ng halaman at iba pang organismo ang pinag-aaralan po dahil sa medical values ito. Ang Department of Science and Technology at ng Philippine Council for Health Research and Development o DOST-PHRD ay binuo po ang Tuklas-Lunas program na nakatutok po sa pag-aaral at pagdiskubre ng mga maaari nating mapagkukunan ng gamot o drug candidates mula po sa sarili nating resources gaya po ng mga halaman o microorganismo sa bansa.
Tama ka, Oni. Layunin ng ating Tuklas-Lunas program na makagawa ng mura at accessible na mga produkto at mga teknolohiya, pangkalusugan at upang mabigyan ng solusyon ang ating iba't ibang health issues sa ating bansa.
Tama po, Secretary, at simula po 2012 na itayo na rin po ang Tuklas-Lunas Development Centers sa iba't ibang parte ng bansa. Ngayon po, mayroon ng 28 implementing partners at 11 po dito ay Tuklas-Lunas Development Centers. Narito ang Mariano Marcos State University sa Batac, Ilocos Sur. Katuwang po ang Institute of Chemistry ng University of the Philippines, Diliman. Nagsagawa po sila ng pag-aaral tungkol sa medicinal values ng 11 indigenous plants. Ngayon pong araw, makasama natin si Dr. Shirley Agrupis upang ibahagi ang kalamang ito para sa atin.
Okay, natutuwa at kasama ka namin dito. Ano nga ba yung mga katutubong halaman na pinag-aaralan dyan sa Mariano Marcos State University? At anong mga pag-aaral ang ginagawa dito? Alam ko na ang mga universidad na kasama sa Tuklas-Lunas ay may kanya-kanyang listahan ng mga halamang pinag-aaralan.
Magandang araw Sir Onin, at gusto ko ring i-greet si Secretary, our very supportive DOST Secretary Fortunato de la Peña. Magandang araw po sa lahat. Indigenous plant or katutubong halaman na tubo lang sa Ilocos Norte, we already have the names. Meron na kaming mga pangalan nito, pero parte ng aming Memorandum of Agreement with the DOST-PCHRD. For the meantime, hindi mo na may disclose because we are still in the process of scrutinizing the potential of these IP plants para gawing gamot in the future.
Dr. Agrupis, ano po naging resulta ng inyong pag-aaral? Mabisa po ba ang mga halamang gamot?
Ang ginagawa namin dito is tinitingnan namin yung mga properties ng mga katutubong halaman sa anti-inflammatory test nila, and then using standard assays, and then we will screen them and identify which are the promising plant to forward to that herbal drug development. So far, 11 plants yung aming tinest na ng anti-inflammatory, and then yung 11 plants na yon, we use different parts of the 11 plants, and then the 37 plants we subjected it to enzyme-based assay para matingnan namin yung ang kanyang efficacy or effectiveness as anti-inflammatory drug. And then we are very happy that out of the 37 extracts we produced from the 11 plants, using a confirmatory test na sinasabi nating orthogonal assay, 21 yung naging active. And very happy kami kasi 4 na extract na galing dito sa 11 plants ay belonging to top 4 top tier, yung sinasabi sa drug discovery. Kung top tier, ang ibig sabihin nun, Sir Onin, is very active to inhibit the enzyme causing inflammation. And then out of the 21 din, 8 yung second tier na active siya pero hindi ganun kasing active yung 4. So itong 12 extract na ito, sinubject namin sa in vitro cell-based toxicity assay using yung mga cell na galing sa heart, liver, and kidney. And ito ay kinandak ng UP Diliman ng Disease Molecular and Epigenetic Lab. Now, I would like to emphasize dito, Sir Oni, that this Tuklas-Lunas Center based at MMSU, which we are following the drug track, is in partnership with UP Diliman and some industry partner. So where are we now dito sa study na ito? We prioritize out of the 12 extract na nag-turn positive, be it top tier or secondary tier. Binalikan namin yung mga halaman kung ano-ano ang mga halaman na ito. So 5 yung mga na-identify na IP plant. So itong mga IP plant na ito, prioritize namin. We are now in good coordination with the sources of this plant, which happen to be the IP community in Ilocos Norte. And then we started using we started extracting. And we ginagamit lang namin yung halaman ba para there is a sustainability of the supply of material. And then this is the phase 2 of our study, because this involved now formulation and standardization of the extract. Now this is now requiring an industry partner. Kaya yun yung nandun na kami sa puntong ito. The formulation is on the side of MMSU. Nagpo-formulate kami, gagawa kami ng dosage form in of capsule. And then yung standardization is nakakabit yan sa Pascual Laboratory. Yun yung aming ginagawa ngayon.
Doc Shirley, bukod sa mapatunayan ang bisa ng mga halamang gamot, paano pa makatutulong ang pag-aaral na ito sa mga local tribes or people?
Malaking-malaki ang maitutulong ng ating local community, Sir Oni, kasi aside from the fact that they will be empowered, because we intend to grow the plants in vivo in the respective locality. Doon na sila. And then by doing that, we are empowering our IP community. So sila yung mag-grow, and in a way, helping them create their own small-scale industry by producing the plant and then ipro-provide sa amin.
Gaano po, Dr. Shirley, kahabang panahon pa ang gugulin bago po matapos ang mga clinical tests na kailangan po natin gawin?
Actually, I would like to highlight here that in the drug discovery, there are 2 tracks. Yung drug track at saka yung herbal track. Dito sa project namin, we decided to follow the herbal track. And according to literature and present experience now, nakatatagal ito ng 7 to 10 years. So tapos na namin yung mga in vitro orthogonal assay. So at present now, nasa formulation na kami on the 3rd year. Nasa formulation na kami at saka standardization ng capsule. And then we have to go back again. So we will go to the toxicity test to evaluate whether yung property niya as a pure extract will still give the same anti-inflammatory test once they are in the formulated form like the capsule. And then we go down to the orthogonal assay. But this time, para i-confirm namin kung yung responses niya nung pure extract pa rin siya is the same pa rin. So, pag okay na siya, then we will go to preclinical test. And this time, it is now the in vivo toxicity test using the mice. So pag positive response na talagang may action yung aming formulated dosage out of the extract, then we proceed to in vivo anti-inflammatory test using yung mice. Siguro itong stages na ito may take us another 2 years. Yung in vivo preclinical test, yung toxicity at saka anti-inflammatory. Kung maganda pa rin, this time we are now using the formulated dosage. Kung maganda, then we will go to phase 1 clinical trials using healthy volunteer individuals. Dito siguro magtatagal. It may take us another 1.5 to 2 years. And then certification. Yung sa phase 1 ng clinical trials, yung katagal niya may be dependent on the number of healthy volunteers. And maybe because this is a pro-community project na pwede naming isali na yung mga community, then with proper coordination with our local government, then siguro mapadali yun because we really need to fast track the herbal drug track only para naman makatulong na sa mga IT community natin sa LGU kasi in time of pandemic talagang with limited mobility, kailangan natin sila empower para hindi sila magsasuffer additional anxiety kung magsasakit sila kung hindi rin lang naman cause ng COVID at may inflammation, pwede na silang mag-take nitong ginagawa natin.
Maraming pong salamat, Dr. Agrupis. Ilan mo po sa mga pinag-aaralan ng Tuklas Lunas ay ang potential anti-dengue drugs, anti-diabetic, anti-hypertensive, and anti-cancer benefits ng mushrooms o kabuti at ang pagtuklas sa posibleng treatment laban po sa COVID-19. Ngayon naman po, pag-uusapan natin ang ilan sa mga pag-aaral na ginagawa po sa ilalim ng Tuklas Lunas program upang labanan ang COVID-19. Una po natin yung clinical trials for Lagundi na isinasagawa ng Institute of Herbal Medicine, University of the Philippines, Manila, National Institutes of Health. Ngayon po yung makakasama natin si Dr. Cecilia Maramba Lazarte. Magandang araw po, ma'am.
Magandang araw po.
Opo. Bakit po nabigyan ng konsiderasyon ang Lagundi, ma'am, na sumailalim sa clinical trial laban po sa sintomas po ng COVID-19?
So alam naman natin ang Lagundi ay isa ng registered na herbal medicine na gawa ng near-prompt IHM. At ang kasama po sa mga indications dito ay mga simptomas din ng COVID, no? Katulad ng ubo, nahihirapan sa paghinga, na currently indication na rin po ng Lagundi. Pero may bagong pag-aaral na lumabas po na maaaring antiviral din po ang Lagundi. May isang pag-aaral na may mga sangkap ang Lagundi na mukhang mataas din yung affinity sa RNA-dependent RNA polymerase ng SARS-CoV-2 na maaaring maging antiviral po ito. So, titingnan natin kung makakatulong to sa ating COVID-19 patients.
Maaaring bang ilarawan, Dr. Cecil, ang isinasagawang clinical trial para sa Lagundi laban sa sintomas ng COVID-19?
So yung aming study team ay pumupunta sa iba't ibang quarantine centers at nag-enroll po kami ng mga positive patients ng COVID-19 na mild at ine-enroll po sila sa study. So actually dalawang stage po yung aming pag-aaral. Yung stage 1, yung dose finding study, at yung stage 2, ito ay placebo-controlled clinical trial. Noon sa stage 1, gusto namin pong malaman kung anong pinakamagandang dose na gagamitin natin sa ating mga pasyente na may COVID-19. Doon po sa stage 2, mas malalaman natin definitely kung talagang may improvement yung mga pasyente dahil po sa ating Lagundi. So, binibigyan po sila nung gamot at fina-follow up sila over time kung ano ang mga naging simptomas nila at kung nababawasan ba ang panahon na may sakit po sila.
Dr. Cecil, kamusta na po yung clinical trials? At this point in time, meron na po ba resulta?
So ngayon, natapos na po yung stage 1 at nagawa po ito sa Quezon Institute at saka po sa PNP Camp Bagong Diwa Special Care Facility. So yung stage 1 na yung dose finding trial, mukhang very promising naman po, no? Very well tolerated po yung Lagundi at maganda po yung feedback ng mga patients na nagiginhawaan po sila dun sa pagbibigay ng gamot, no? So, yung mga adverse effects din po, napakakonti. So mukhang very promising po siya. Kaya nag-proceed po kami doon sa stage 2. So at the moment, nasa halos 3/4 na po kami ng stage 2 at malapit na rin namin matapos para talagang ma-analyze po natin yung data.
Maraming salamat, Dr. Cecil. At ngayon naman pag-usapan natin ang tungkol sa tawa-tawa. At kasama natin ngayon si Dr. Philip Ian Padilla mula sa University of the Philippines, Visayas, upang bigyan tayo ng update tungkol dito. Doc Padilla, ang pagkakaalam ko itong tawa-tawa ay unang pinag-aralan bilang treatment sa dengue. Paano naman nagsimula na magkaroon tayo ng clinical trials para panlaban sa COVID-19?
Thank you very much, Secretary Boy. Tama yung sinabi mo na yung tawa-tawa ay naunang nakita na may konting epekto siya sa ating problema sa dengue. Ngayon, dahil may COVID-19, nakikita din sa ibang laboratorio na may effect din pala siya sa ibang virus katulad ng COVID-19. So ngayon, dahil sa isang study at pag-aaral na ginawa din, may konti yata yung epekto or side effects ng ating tawa-tawa Urbanex na formulation dun sa mga pasyente na nagka-dengue. So ngayon, kasi gusto natin magkaroon pa ng ibang produkto, yung Pilipinas, lalo na sa herbal medicine, sa larangan ng herbal medicine, tinitingnan natin ngayon kung yung tawa-tawa mismo na naaprubahan na bilang supplement, food supplement, ay baka may epekto din at maggagawa ng paraan para mas mapagaan yung mga simptoma ng mga pasyente na may mild at moderate na COVID-19.
Dr. Padilla, ano po yung ginagamit po ninyo para sa clinical trials at paano po ang pag-aaral na inyo pong ginagawa dito?
So ngayon, yung formulation na yon ay ginawa ng isang Tuklas Lunas na supported na private company dito sa Bacolod. Ang tinatawag doon Urbanex. So may formulation na-approve actually ng FDA bilang food supplement. So ngayon, nagre-recruit din tayo tulad doon sinasabi ni Dr. Lasarte. Ngayon, naghahanap pa rin kami ng pasyente kasi kakasimula lang yung tawa-tawa clinical trial. Pero yung center, medyo magkaiba doon sa Lagundi dahil sa Bacolod na quarantine center at sa District Hospital sa Bacolod City yung aming main recruitment or main clinical center, pero kasama din yung PGH at yung Quezon Institute.
Kailan matatapos itong ating mga clinical trials, Dr. Padilla? At meron na bang mga nakikita magandang potential?
Thank you, Secretary Boy. Yeah, medyo nagka-delay yung ating clinical trial for tawa-tawa dahil sa mga bureaucratic na red tape. Pero ngayon, nagsimula na siya, na-approve na po yung ating review at ngayon nagsisimula na ng recruitment ng mga pasyente. So it will take maybe another 4 to 6 months para makuha yung lahat ng datos at makakuha tayo ng exact number na nakaspecify dun sa proposal with regards to mga na-recruit natin na mga pasyente at naibigyan or na-subject siya sa or naka-participate sila sa tawa-tawa trial. So unlike sa Lagundi na halos matatapos na sila, medyo ang tawa-tawa clinical trial nagsisimula pa lang. So hopefully by April, naka-recruit na tayo ng initial batch of patients, lalo na sa Bacolod kasi mas marami na rin yung mga pasyente na nagkaroon ng mild at moderate dito sa Western Visayas.
Alright. Maraming salamat po, Dr. Padilla. Bukod po sa mga clinical trials para po sa mga posibleng treatment ng COVID-19, sinuportahan din po ng DOST, PCHRD ang isang pag-aaral tungkol po sa clinical profile ng COVID-19 sa Pilipinas. Ito po yung the Philippine Coronavirus Disease 2019 or COVID-19 Profile Study, Clinical Profile and Factors Associated with Mortality of Hospitalized Patients. At para ibahagi po sa atin ang resulta, makakasama po natin si Dr. Leslie Kiwa. Dr. Leslie, magandang araw po sa inyo.
Magandang hapon, Sir Onin.
Apo, maaari po bang ibigyan niyo po kami ng ibigyan niyo po sa amin ng ilang bahagi ng background ng pag-aaral po rito?
Actually, yung study na to, halos more than 1 year ago, no, nag-meeting po kami sa PCP Research Committee. Meron kaming strategic meeting noong March 8. Tapos naging suggestion po no ng isa naming kasamaan si Dr. Nicodemus na bakit hindi natin tignan ang local data ng COVID kasi parang wala masyadong nag-aaral. No? Kasi baka maraming report na abroad pero baka may kakaibang datos sa atin. No? Tapos nasuportan po kami ni Dr. Montoya sa PCHRD, nag-suggest siya na humingi ng research grant. Tapos natulungan rin kami ng DOH, yung review board niya para sa ethics approval. Tapos yung PCP po, yung pinaka-organization ng internal medicine ng mga practitioners sa Pilipinas, yung presidente si Dr. Nazareth, very supportive. Tapos in-endorse po yung study namin sa lahat ng mga training institution kasi mga 121 yan sa buong Pilipinas. Out of that, 89 ang nag-participate. So marami.
Kasi sa pag-aaral niyo, Doc Leslie, gaano ba kataas ang in-hospital mortality?
Ang mortality rate kasi sa ospital, medyo mataas ng kaunti at 18.5%. Kasi ito ang mga pasyente na siyempre severe enough yung kaso nila para ma-admit sa ospital. Pero ang importante natin matandaan dito, ito yung panahon ng February 1 hanggang July 15. Ito po kasi yung inclusion period namin. Ngayon, may mga pag-aaral po sa abroad na sinasabi dahil sa mga lumabas na ng mga bagong datos, tulad ko na rin hydroxychloroquine, hindi na masyadong ginagamit, pwede nang gamitin ng mga ibang gamot, may yung dexamethasone, etc. Mas mababa na ang mortality rate ngayon kumpara noon. Pero kailangan natin ng bagong pag-aaral para malaman natin kung talagang bumaba na. Pero noon, early part ng pandemic, 18.5% po.
Dr. Leslie, ano po yung mga nakita niyong factors o mga bagay na nauugnay sa pagkamatay po ng ilang mga COVID-19 patients sa mga ospital?
So ang pinaka-major purpose talaga ng study na yan, ng study namin, para aralin ano ba ang mga magpe-predict ng mga pasyente na yung magiging pangit ng outcome, kunwari mamamatay sa COVID. So ang na-discover namin, kapag mas matanda sa 60 years old, mga 3 times na mas mataas ang chance mamatay sa COVID kumpara sa mas bata sa 60. Yung average age kasi ng mga pasyente namin sa study, 2,884 patients, 50 years old. Yung mga average age ng namatay, 64 years old. Pero yung mga nag-recover, nakauwi, 46.7 yung average age. So makikita natin mas bata yung mga nagre-recover. Pero kung pag-uusapan naman, kunwari yung sa lalaki pati babae, pinag-aralan din namin yun. Pareho lang naman, no? Hindi porke lalaki o babae ka, mas mataas ang chance.
Doc Leslie, siguro ako gagawa ng rekomendasyon na dapat ay gumawa ulit tayo ng repeat na pag-aaral or another period. So siguro pag-uusapan namin yan sa DOST PCHRD. Pero ano ang mga makukuha mong rekomendasyon mula sa inyong pag-aaral na nagawa?
Siguro ang isa sa mga unang ay pinaka-major recommendation namin dahil factors ang na yung hinanap talaga namin. Siguro yung mga clinicians natin o mga doktor na nag-handle ng COVID, kapag nakita nila yung mga factors na identify namin na nagpapatasan chance, mas vigilant sila or mas matindi ang pagbantay sa mga pasyente. So tulad ng nasabi ng kanina, ito yung mga mas matanda sa 60, may hypertension or alta pressure, yung humihinga ng mas mabilis sa 22 sa isang minuto, at yung mataas ang white blood cell count sa laboratory examination na tinatawag na CBC, lagpas 10, at yung mataas ang tinatawag na LDH or lactate dehydrogenase, mas mataas sa 250. Ito po yung sa Filipino patients na nakita namin na kapag yan ang mga factors na nakita, mas kailangan natin bantayan. Tapos siguro pangalawa, maganda nga talagang ituloy yung study kasi ito pang simula lang part ng pandemic. Marami na pong nangyari, marami ng bagong mga gamot at mga technology na ginagamit, mga treatment practices. So baka medyo nagbago na rin yung makikita natin. So maganda pong matuloy yung pag-aaral.
Alright. Muli maraming pong salamat Dr. Kiwa at sa tatunating panauhin na si Dr. Padilla at Dr. Lazarte at Dr. Agrupis sa amin pong pagbalik sa sagutin ni Secretary Boy ang tanong ng bayan. Wag po kayong bibitiw, magabalik pa ang DOST report. Oras na para sagutin ni Sec Boy ang tanong ng bayan para po sa unang katanungan mula kay Lynn Resurrection ng Business Mirror, kay Ana Basurara ng Radyo Avila at Divine Reyes ng columnist Unlad Bayan News Weekly. Meron pa po bang ibang herbal supplement na planong i-test for clinical trial?
For COVID-19, hindi ko masagot kung meron pa iba i-test. Pero ang dami kasi natin tinatry para sa iba't ibang uri ng sakit. Baka mabigyan tayo ng idea ni Dr. Cecil kung meron bang mga iba pang posibleng i-try para sa COVID-19.
Specifically po sa COVID-19, so far wala pa kaming masyado na specific sa COVID-19, but we could try others na possibly anti-inflammatory, no? Pero kailangan pa natin mag-literature search para dito.
All right. Ang tanong mo po nila, ano ang magandang ibubunga ng puspusang pananaliksik tungkol po sa clinical profile ng COVID-19?
Yan na nga ay nabanggit na kanina na makatutulong sa ating mga clinicians, pero siguro humingi tayo ng tulong kay Doc Leslie.
Siguro, yung pag-identify kasi ng mga factors na yung makapag-predict ng mortality, importante yun eh. Kasi tulad ngayon, di ba, ang dami ng pasyente natin sa COVID. So, gusto namin malaman, sino ba ang kailangan natin mas bantayan sa mga pasyente para doon natin ilagay more of yung monitoring at resources. No? So, yung pag-identify ng mga factors na mas mataas ang chance mamatay itong pasyente na to kumpara sa iba, ay malaking tulong na rin para sa ating mga doktor na nag-handle ng COVID.
Ito naman po itanong ni Meli Tenorio ng Siyensya na Teknopan ng Radyo Agila. Ano po ang latest na pinagkakalwalahan ng PCHRD na may kaugnayan sa kalusugan sa gitna po ng pandemya, maliban sa clinical trial ng vaccine at food supplements?
Tayo puspusan na naghahanda para sa WHO Solidarity Vaccine Trials. Anytime ngayon ay i-announce na ng WHO ang mauunang vaccine na susubukan sa WHO Vaccine Solidarity Trials, at ang Pilipinas ay isa sa mga bansa na mauunang sasama sa Solidarity Trials. So maaaring hindi sabay-sabay yung mga bakuna na yan, pero one after the other. Okay.
All right. Ito po itanong mula kay Divine Reyes ng Unlad Bayan News Weekly. Ano pong insentibo na ibinibigay ng DOST sa mga mananaliksik ng halamang gamot?
Standard naman ang aming insentibo. Alam mo naman na amin lang na ibibigay pampalubag loob lang. At ang ating mga researchers na mga Pilipino ay talaga namang out of dedication and love for country. Kaya kami nagpapasalamat sa kanila ng lubusan.
Alright. Again po, maraming salamat po Secretary Boy at sa ating mga naging panauhin kay Dr. Shirley Agrupis ng Mariano Marcos State University, kay Dr. Cecilia Maramba Lazarte ng UP Manila, maraming po salamat, kay Dr. Philip Ian Padilla ng UP Visayas at kay Dr. Leslie Kiwa. Secretary, baka may mga pahabol pa kinais sabihin para sa ating mga kasama at sa ating mga subscribers at mga followers?
Napakalaki po ng role na ginampanan ng ating mga researchers sa health area, lalo na itong mga pag-respond sa ating problema sa COVID-19. At kaya ako'y nagpapasalamat sa kanilang lahat. At ini-encourage ko din yung mga iba pa nating mga mananaliksik na kasama sa aming Tuklas Lunas na siguro hanggat maaari, bilis-bilisan na natin ang ating mga ginagawa para maging timely sa iba't iba pang mga karamdaman. Napakarami pong iba-ibang klaseng karamdaman na hindi naman kailangang bumili ng napakamahal na gamot dahil napakarami natin ditong pagkukunan dito sa ating bansa. So, suportahan natin ang research and development, suportahan natin ang program ng Tuklas Lunas, at siguro doon sa mga doktor din naman ay siguro tangkilikin natin ang mga gamot na nade-develop dito sa ating bansa. Salamat po.
Maraming po salamat mga kaibigan, si Secretary Boy Puyan at ang ating mga panauhin. Abangan niyo po mga kaibigan ang Bantay Vulcan ting Martes at Expert Talk Online ting Miyerkules alas 5 ng hapon. Kasama po si Jel Miranda sa DOST TV Facebook page at YouTube channel. Mas marami pang balita mula sa mundo ng siyensya at teknolohiya ang ating pag-uusapan, kaya tutok lamang ting Biyernes alas 4 ng hapon dito sa DOST TV Facebook page. Ako po si Oning Miranda. Ito ang mga balitang may kinalaman sa siyensya at teknolohiya para sa bawat Pilipino straight from the S&T Authority ng bansa. Ito ang DOST Report.